Hello dear patients, today we are going to review the case presented on the picture. This is a case of smegma discharge from glans penis. This young man had constant white discharges with cheesy component on glans penis. Sometimes his girlfriend complained on cystitis after sexual act. In such cases, doctors as well as patients and the whole internet say that this is candida. They say that this is only candida and you should use clotrimazol and it all will be good. It will never be good from clotrimazol, at least because candida remains in urethra. It penetrates there, but this is a story of our separate videos. In this patient, PCR-8 analysis for candida was taken from these discharges. In this case, it's very important not to wash glans penis. Bacterial culture test was taken for bacteria and sensitivity to antibiotics, and culture test was taken for fungi, for candida. It can happen that analysis as well as PCR not always show candida. So here it's better to take both analyses, not washing glans penis for at least a day, if candida is suspected. Indeed, this has to be done, but you should understand that reality is a bit different, and if such discharges are present, then in approximately 1/3 of cases we have candida. In all the other cases, as in this one, these are some bacteria or just smegma. As a result of that, neither in culture test for candida nor in PCR for 8 infections candida was found. Apart from that, in PCR analysis, gardnerella and some other sexually transmitted infections were taken. You can watch a separate video on our channel about what analyses are required during balanoposthitis and deposits on glans penis. Only an increased number of bacteria was found. These bacteria were usual. This was epidermal staphylococcus in 10 to 6th power. This was enterococcus in 10 to 3rd power. As a result, the conclusion was made that this deposit is normal for this young man. This is smegma in combination with bacteria. What is smegma? Smegma is a discharge of so-called Tyson's glands, located on glans penis. They are an analog of sebaceous glands. In the areas that are wet, where the skin is thin, a large number of bacteria is formed. If they multiply a lot, then this can induce inflammation in genitourinary tract of women, particularly if they have weak immunity or have some ureaplasma, for example. If there are bacteria that should not quite be there, that is not only epidermal staphylococcus, but some others as well, then they should be treated. In our case, antibiotics were prescribed according to sensitivity of enterococcus, as it shouldn't be on glans penis, and it can induce cystitis in a woman. A woman was recommended to do culture tests. She is observed by urologists and gynecologists at the place of living. After the course of therapy, together with external therapy, with compresses, baths, etc., a decrease of volume of discharges was noted. The patient was recommended to think about doing circumcision, and apart from hygienic procedures and baths with disinfectant medications like chlorhexidine, nothing else should be done in this case, as this is a variant of normal. If it doesn't bother the partner in any way, then no treatment actions should be used for that. If it is necessary to diagnose and treat different deposits on glans penis, different diseases of glans penis, you can consult venerologists and dermatovenerologists of our paid medical center of Dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of any pathologies of sexual organs area. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.